this 3-module course, you'll come to understand when and where individuals with obesity experience weight discrimination and how you can help eliminate this form of discrimination within your practice or healthcare facility. Welcome. After completing this module, participants will be able to create a culture of sensitivity, prepare the facility for the bariatric patient, emphasize the importance of facility-wide awareness training, and assess their hospital and practice. The first step in preparing the facility is creating a culture of sensitivity. It's critically important that every healthcare professional identify any negative feelings they may have toward patients with obesity and change this attitude so that patients feel comfortable. Discrimination is not acceptable. Patients expect healthcare professionals to understand this more than anyone. Whether you're a physician, nurse, administrator, or from the departments such as transportation or facility services, you play a vital role in creating a culture of sensitivity. You should lead by example by fostering a secure, protective, and professional environment. Become an advocate for sensitivity. Consider the environment in which you care for your bariatric patients. Evaluate the facility by asking the following questions. When patients arrive at the facility, how close is the parking to the building? Is it easily accessible? Is there adequate seating for larger individuals? Has your staff been trained on appropriate language to use to avoid offending overweight individuals or people with obesity? Is there adequate space in the hallways and seating areas? Is the temperature comfortable? The next step in creating your environment is to evaluate all departments within your facility. In the private practice setting, you should design and provide surroundings specifically with the bariatric patient in mind, including larger hallways and exam rooms, appropriate bariatric furniture and exam tables, larger blood pressure cuffs, dressing gowns, and weight scales located in a private area. Every detail that's incorporated with the bariatric patient in mind will create a more positive patient experience. Within the hospital setting, there are many departments that come in contact with the bariatric patient. Each area should be prepared to provide a respectful, caring experience. These include your admissions and business office, laboratory, radiology, operating and recovery rooms, physical and respiratory therapy, transportation, emergency rooms, janitorial, and more. Imagine this. You have a beautifully prepared facility with appropriate equipment and access. A floor nurse properly greets the bariatric patient with kindness and consideration, but then goes into the hallway and makes inappropriate comments to another staff member, which are overheard by the patient and his or her family. Think of all the time and investment that management put in place to create a culture of sensitivity that was rendered ineffective because of staff bias and discrimination. Management and staff members must be aware of their own as well as fellow staff members' behaviors and attitudes and be prepared to intervene as necessary. Sensitivity is not optional. As part of your facility readiness, protocols for when and how often staff is trained should be defined. Identify departments and staff for training and secure dates, times, and locations in order to maximize attendance. In defining protocols, consider the following. Are new hires required to go through sensitivity training as part of your system-wide orientation? Will employees be required to review this training annually? Remember, creating sensitivity for patients with obesity is not a one-time activity, but must be fostered through well-established, documented, and continual training. Now, take a moment to examine the current culture within your facility. Do you feel your practice, program, or hospital provides a sensitive environment for the bariatric patient? Why or why not? We've included a facility sensitivity assessment form in the practice tools section associated with this course. Use this form to determine your facility's baseline sensitivity awareness. By fostering a sensitive and compassionate environment, you'll empower patients and build their confidence, which in turn will provide for a positive experience and will help build a community reputation for exemplary bariatric care. In conclusion, we encourage you to evaluate your current environment. Ensure you're providing a culture of sensitivity for your bariatric patients. We hope you've enjoyed this course and find the information valuable to your practice.